So gynecomastia is a techie medical term which just simply means enlarged breasts in men. Um, it can be a really sensitive topic for many men. It's fairly common, it's more common than what most people would assume is out there though. Look, the main issues with gynecomastia for men is obviously there's a feeling of self-consciousness about having enlarged breasts. And it's not because people want to necessarily parade around the place topless. It's more just feeling like they can wear fitted shirts and t-shirts comfortably without feeling conscious about the size of their breasts and their nipples. In essence, the surgery for gynecomastia is relatively straightforward, and it usually involves removing the excess breast glandular tissue, but also doing some liposuction of the chest wall as well to remove some of the fatty tissue. It is important, however, before you have surgery, that the causes of gynecomastia are also investigated and excluded. And seeing your primary healthcare physician first up would be very appropriate. It normally entails some blood tests, making sure your hormone balances are okay, and also potentially doing some scans, in particular an ultrasound of the breasts, to make sure that there's no masses in there or nothing else that could be causing those problems. Sometimes seeing an endocrinologist, which is a specialist physician who looks after metabolism and hormones, is also important. But in essence, the surgery itself is relatively straightforward, and it works well. There is the risk of recurrence as well after surgery, so tissue can grow back, which is why it's important to make sure that there are no causes of the gynecomastia that are potentially still there that can cause a regrowth to occur.